Hey, stop right there, because what I'm about to tell you may completely change the way you think about your morning walk. Most people over 50 have been told to eat something before exercise. Fuel up first, the magazines say. Don't work out on an empty stomach. But what if that advice, right, the advice repeated by morning talk shows and well-meaning friends for decades, is actually working against you? What if the single most powerful thing you can do for belly fat after 50 costs you absolutely nothing, requires no equipment, no gym membership, and happens before you eat your first meal of the day? A landmark study published by researchers at the University of Bath found that walking in a fasted state before breakfast burned up to 70% more fat than the same walk performed after eating. 70%. And for people over 50, the metabolic implications of that number are extraordinary. We're going to break down exactly what happens inside your body during a fasted morning walk, why it works even better as you age, and I'm going to count down 5 specific physiological changes that happen, ranked from impressive to absolutely jaw-dropping, with number 1 being something most doctors will never bring up at your annual checkup. And here's a teaser for you. The number 2 item on our list involves something called mitochondrial biogenesis, a process that essentially builds brand new cellular engines inside your muscle tissue. And after the age of 60, this process drops by nearly half unless you trigger it with very specific conditions. A fasted morning walk is one of the most powerful triggers we know of. Stick around, because that one will change how you think about aging entirely. But before we dive in, I want to ask you something personally. Leave a comment below telling me your age and whether you currently walk in the morning, and if so, do you eat first or go out fasted? I genuinely read every single comment on this channel, and your answer helps me make better content specifically for you. Now let's get into it. I'm Dr. Thomas, and I've spent over 2 decades working with patients in the 55 to 85 age range. I've seen what moves the needle and what doesn't. What I'm sharing today isn't trendy fitness advice, it's physiology. Real science applied to the real aging body. All the research I reference today will be linked in the description below. Starting at number 5. The first thing that happens when you walk on an empty stomach after 50 is that your insulin levels drop to their lowest point of the day, and that single hormonal shift unlocks fat burning in a way that eating before exercise simply cannot replicate. Here's how to understand it. Think of insulin like a locked door. When insulin is high, which happens every time you eat, especially carbohydrates, that door is closed and your fat cells are sealed shut. Your body cannot access stored fat as fuel when insulin is elevated. It's biochemically blocked. But when you wake up after 7 or 8 hours of sleep, your insulin has bottomed out. That door is wide open. And when you start walking in that state, your body has no choice but to turn to stored fat, including visceral belly fat, the dangerous deep fat that wraps around your organs, for energy. Now here's where this becomes especially important after 50. Research from the Mayo Clinic has shown that visceral fat accumulation accelerates significantly after menopause in women and after testosterone decline in men, typically beginning in the early 50s. The belly you may have noticed growing, despite eating the same diet you've eaten for years, isn't a willpower failure. It's hormonal. And fasted walking directly addresses the hormonal environment that allows that fat to accumulate. A study from the Journal of Nutrition found that individuals who exercised in the fasted state showed a 20% greater reduction in waist circumference over 12 weeks compared to those who ate before exercise, even when total calorie intake was identical. The practical application here is simple. Walk within 30 to 45 minutes of waking up before consuming anything other than water or plain black coffee. Keep the walk moderate, in a brisk pace where you can still hold a conversation but feel slightly breathless. 20 to 30 minutes is enough to trigger meaningful fat oxidation. If you have diabetes or are on blood sugar medications, please check with your physician first, as fasted exercise can affect glucose levels. Moving to number 4. When you walk fasted, your body activates something called AMPK, adenosine monophosphate activated protein kinase. I know that sounds like a graduate school chemistry exam, but here's what you need to know. AMPK is your body's master energy sensor. Think of it like the emergency dispatch center of your metabolism. When your body senses it has low fuel reserves, which is exactly what happens during a fasted morning walk, AMPK fires up and sends signals throughout your entire body to start burning stored energy more efficiently. It also suppresses fat storage signals at the same time. Here's why this matters uniquely for people over 50. Research from the University of Michigan Medical School has shown that AMPK sensitivity declines with age. In other words, the signal gets weaker. By the time you're 65, your body's ability to activate this metabolic switch is measurably blunted compared to a 35-year-old. But And this is critical. Fasted exercise is one of the most reliable ways to force AMPK activation regardless of age. You're essentially bypassing the age-related decline by creating the exact conditions that demand the pathway turn on. A patient of mine, Margaret, 68 years old from Scottsdale, Arizona, had been struggling with stubborn midsection weight for over a decade. She was walking every day, faithful, disciplined, but always after her morning oatmeal. We shifted her to fasted walks, same duration, same pace. Within 8 weeks, she had lost 4 inches from her waist and her fasting glucose had dropped 14 points. She told me it felt like someone had flipped a switch. That switch has a name. It's AMPK. To pair this benefit, consider adding a small amount of physical resistance to your walk, walking uphill using light wrist weights or doing 5 minutes of bodyweight squats before you head out. Resistance activity dramatically amplifies AMPK activation, and the two together are significantly more powerful than either alone. Number 3 is where the science becomes genuinely exciting. When you walk in a fasted state, your body's growth hormone surges, and for aging adults, this is one of the most underappreciated benefits of the practice. Growth hormone is the repair and rejuvenation hormone. It rebuilds muscle, burns fat, strengthens bone, improves skin elasticity, and protects your cardiovascular system. At age 25, most people produce significant amounts naturally. By age 60, production has dropped by roughly 75%. By age 75, it has often declined by over 80%. This isn't a small dip, it is a cliff. Research published in the Journal of Clinical Endocrinology and Metabolism found that a single bout of fasted aerobic exercise can increase growth hormone output by as much as 400 to 2,000% compared to resting baseline levels. That is not a typo. The fasted state combined with moderate aerobic activity creates a hormonal environment that mimics in a meaningful way what your body did naturally when you were decades younger. Now, why does the empty stomach matter here? Because insulin and growth hormone are essentially opposite hormones. When insulin is high, growth hormone is suppressed. When insulin is low, as it is in the fasted state, growth hormone can rise uninhibited. Eating before your walk keeps insulin elevated, which blocks this surge entirely. This is the mechanism most people are never told about, and it is why a fasted morning walk is categorically different from an after-breakfast stroll, even if the distance and pace are identical. A gentleman I worked with named Robert, 72, from Nashville, Tennessee, came to me after a follow-up DEXA scan showed he had lost significant lean muscle mass over 2 years, a condition called sarcopenia, which simply means age-related muscle loss. We added fasted morning walks 5 days a week, and within 6 months, his follow-up scan showed he had actually reversed a portion of that muscle loss without any change to his diet. The growth hormone response was doing quiet, powerful repair work every single morning. If you want to amplify this effect, consider this synergy. Immediately after your walk, consume a high-quality protein source, eggs, Greek yogurt, or a whey protein shake. The elevated growth hormone from your fasted walk, combined with a protein hit, creates an anabolic window, a period where your muscles are primed to absorb and use amino acids for rebuilding. This combination is significantly more effective than protein alone. And right here, between items 3 and 4, if this information is resonating with you, if you feel like you're finally getting the explanation that no one at the doctor's office took the time to give you, please take 2 seconds and hit the subscribe button and give this video a like. It genuinely helps this channel reach more people over 50 who deserve to have access to this kind of information. Thank you. Number 2, and I told you this one was coming, fasted morning walking after 50 is one of the most powerful triggers for mitochondrial biogenesis, and I want you to understand exactly what that means because it may be the most important thing I say in this entire video. Your mitochondria are the energy factories inside every cell in your body. They convert food and oxygen into the fuel that powers every movement, every thought, every heartbeat. When you're young, your body maintains mitochondria efficiently. But after 50, and especially after 65, the number and function of mitochondria in your muscle cells begins to decline. This is one of the primary drivers of fatigue, weakness, slowed metabolism, and increased fat storage in older adults. It's not laziness, it's cellular. Mitochondrial biogenesis is the process of building new mitochondria. It is, in the most literal sense, cellular rejuvenation. And research from Harvard Medical School and the National Institute on Aging has confirmed that fasted aerobic exercise is among the most potent stimuli for this process in the human body. The mechanism involves a protein called PGC1 alpha. Think of it as the foreman who orders the construction of new mitochondrial factories. Fasted exercise dramatically upregulates PGC1 alpha. Fed exercise does so only modestly by comparison. Here's the aging-specific detail that makes this so important. A study from the Mayo Clinic proceedings found that after the age of 65, sedentary individuals lose mitochondrial efficiency at roughly twice the rate as active individuals. But the same study found that aerobic exercise performed in a low glycogen, low insulin state, which is exactly the fasted morning walk scenario, could increase mitochondrial density in older adults by up to 35% over 12 weeks. More mitochondria means more energy. It means a faster metabolism. It means your body burns more calories at rest all day long, even while you're sitting in your favorite chair watching television. I had a patient named Dorothy, 77 years old, from Portland, Oregon, who told me she had accepted that she would be tired for the rest of her life. She slept 8 hours and woke up exhausted. Her doctors had checked her thyroid, her iron, everything came back normal. She was simply, as she put it, old and worn out. We started her on 20-minute fasted walks 4 mornings a week. By week 10, she called my office to tell me she had reorganized her entire kitchen, gone for 2 back-to-back walks in 1 day, and slept better than she had in 15 years. Her mitochondria had been rebuilt. The factory had new equipment. To maximize this benefit, pair your fasted walk with a period of mild sunlight exposure, morning sun specifically. Research from the Salk Institute suggests that light-driven circadian signaling enhances mitochondrial function and energy metabolism, and the combination of fasted exercise plus morning sun creates overlapping biological signals that reinforce each other in remarkable ways. And now, number 1. The most powerful, least talked about effect of fasted morning walking after 50. Fasted walking triggers a process called autophagy, your body's built-in cellular cleaning system. And after 50, this process is the difference between aging well and aging poorly in ways that go far beyond your waistline. Autophagy comes from the Greek words meaning self-eating, and while that sounds alarming, it is one of the most beautiful and important things your body can do. During autophagy, your cells identify damaged, dysfunctional, and aging components, misfolded proteins, broken mitochondria, cellular debris, and they systematically dismantle and recycle them. Think of it like a deep cleaning crew that comes through your body and removes everything that shouldn't be there. The reason this is number 1 is because autophagy is not just about fat loss. It is directly linked to the prevention of Alzheimer's disease, Parkinson's disease, type 2 diabetes, cardiovascular disease, and multiple forms of cancer. Research published in the journal Cell Metabolism found that autophagic activity declines by approximately 40% between the ages of 50 and 70. And this decline correlates strongly with the acceleration of age-related disease during those same decades. The accumulation of cellular junk that autophagy is supposed to clear is now understood to be a root cause, not a side effect, of aging itself. What triggers autophagy? Fasting, low insulin, and aerobic exercise. A fasted morning walk delivers all 3 simultaneously. Research from the University of Texas Southwestern Medical Center showed that exercise alone can initiate autophagy within 30 minutes of beginning activity, and that the effect is dramatically amplified in the fasted state. After the age of 60, your body's ability to initiate autophagy spontaneously is significantly reduced, which means deliberate triggers, like your morning walk before breakfast, become not just beneficial, but essential. This is the explanation for something many of my patients describe, a sense of mental clarity, lightness, and calm that follows their fasted morning walks and doesn't come from after-breakfast exercise. That feeling has a biological explanation. Autophagy clears neurotoxic debris from brain tissue. It reduces systemic inflammation, the chronic low-grade inflammatory state that underlies nearly every major disease of aging. The walk is doing something profound at the cellular level, and the empty stomach is the key that unlocks the door. A patient named Gerald, 81 years old from Baton Rouge, Louisiana, was referred to me after a family member noticed cognitive changes, word-finding difficulties, slower processing. His neurologist had found mild cognitive impairment. Gerald began fasted morning walks, just 20 minutes, 5 days a week. A year later, his cognitive reassessment showed stabilization and, in 2 areas, meaningful improvement. His neurologist was, to use his word, surprised. I was not. Autophagy was doing its work. To deepen this benefit, consider pairing your fasted walk with a brief period, 10 to 12 hours, of overnight fasting before the walk. If you finish dinner at 7 p.m. and walk at 7 a.m., you have created a 12-hour fasting window. Research from the Salk Institute and the Huberman Lab at Stanford suggests that this window is where autophagy reaches its most productive phase, and adding movement within that window accelerates the process significantly. Here is what I want you to take away from today. You are not too old. your body is not broken. It is waiting, genuinely waiting for the right signal. A fasted morning walk is not a punishment or a deprivation. It is a conversation with your biology. It tells your body in the clearest language it understands to burn stored fat, to build new energy factories, to release repair hormones, to clean house at the cellular level. These are not things your body has forgotten how to do. They are things it does the moment you give it permission. I have watched patients in their 70s and 80s reclaim energy they thought was gone forever. I have seen belly fat melt away after years of failed diets. I have seen cognitive function stabilize, joint pain reduce, blood sugar normalize, all connected in meaningful part to this one simple, free, powerful habit. 20 minutes before breakfast, 5 days a week. That is the prescription. It is never too late. The research does not have an age cutoff. Your cells do not read your birth certificate. They respond to signals. And starting tomorrow morning, you can give them exactly the signal they've been waiting for. If this video helped you, please subscribe to this channel. We publish new evidence-based content for people over 50 every week, and I promise you will never get generic advice here. Hit the notification bell so you don't miss anything. And now I want to hear from you. Leave a comment below telling me your age, where you live, and whether you're going to try a fasted morning walk this week. I read every single one. I'll see you in the next video.